Most people think medical emergencies are handled in hospitals, but that's not where they begin. They start at home quietly, unexpectedly, and often without any clear instructions on what to do next. Someone feels a sudden pain, a sharp discomfort in the chest, a strange dizziness that doesn't go away. It doesn't look dramatic at first. There's no alarm, no clear signal that something serious is happening, just uncertainty. And in that moment, there's no doctor, no immediate help, just a decision that needs to be made without enough information. So people do what feels logical. They wait. They sit down, hoping the feeling passes. They try to rationalize it. Maybe it's stress. Maybe it's something they ate. Maybe it's nothing. But as minutes pass, the uncertainty doesn't go away, it grows. Because the real pressure in these situations isn't just the symptom itself. It's not knowing what that symptom means. And without that understanding, every option feels risky. Act too early, and you might be overreacting. Wait too long, and you might be too late. So people start searching for answers in whatever way they can. They recall things they've heard before. Advice from friends. Something they once read online. Fragments of knowledge, pulled together under pressure. But fragments don't form a system. They might recognize one symptom, but not the pattern. They might know one response, but not when it applies. So actions become inconsistent. One person might ignore something serious. Another might panic over something harmless. Both are reacting, but neither is truly understanding what's happening. That's where most mistakes are made. Not because people don't care, but because they're forced to operate without a framework. So naturally, they try to compensate. They keep medications at home, just in case. Painkillers, antibiotics, leftover prescriptions. It creates a sense of control, a feeling of being prepared. But when the moment comes, a different problem appears. Which one should you take? When? How much? Does it even apply to this situation? The presence of tools doesn't solve the absence of clarity. And that's the part most people overlook. The real issue isn't that there's no doctor. It's that there's no system guiding the decision. In a hospital, decisions aren't random. They follow patterns. Symptoms are evaluated in context. Certain signs matter more than others. Some combinations trigger urgency, others don't. But at home, without that structure, everything feels equally important or equally uncertain. It's like trying to navigate without a map. You can move, but you don't know if you're heading in the right direction. And this becomes even more critical when time matters. In situations like strokes or heart-related events, the difference between acting early and acting late isn't small. It changes outcomes completely. But recognizing those moments requires more than awareness of symptoms. It requires understanding what those symptoms mean together. That's the structural layer most people never develop. And yet, in places where access to healthcare becomes limited, people are forced to develop it. Not perfectly, not with full certainty, but enough to make better decisions than guesswork. They start to observe patterns. They learn that certain symptoms don't appear alone. That timing matters. That intensity changes the interpretation. That what feels mild at first can escalate or stay stable. They don't treat every symptom the same. And they don't ignore everything either. They begin to filter. That shift from reacting to interpreting is what allows them to handle situations without immediate medical help. Because once you understand what you're looking at, your response becomes more intentional. You're no longer just trying things. You're making decisions based on signals. And that doesn't eliminate risk. But it reduces unnecessary mistakes. It also changes how people prepare. Instead of collecting random solutions, they focus on understanding categories. What kinds of problems are likely? What signs point to escalation? What can be managed at home, and what crosses a line? Preparation stops being about having more and starts being about knowing how to think. Because in reality, most emergency situations don't give you time to research. They don't wait for clarity. They force decisions in real time. And the only thing you bring into that moment is what you already understand. Not what you saved. Not what you plan to learn later. What you already know. That's why the difference between panic and control often isn't resources, it's structure. If you want a more structured breakdown of how to interpret symptoms, understand what actually matters in those moments, and avoid the most common mistakes people make when they're on their own, there's a practical guide linked in the description that goes deeper into this. You can also subscribe if you want more videos that focus on understanding these situations clearly, instead of reacting to them blindly. Because when you understand the structure behind the situation, you don't need perfect conditions to make better decisions.